Is your child's picky eating actually anxiety? Almost or very frequently in clinic, I do see parents who have tried it all. They have picky eaters who are refusing to eat most of the foods that are offered. I had recently in clinic a parent who told me they had been to occupational therapy. However, after multiple sessions, this kid was still refusing to eat most of the foods that were offered. As a matter of fact, the list was shrinking on a monthly basis. Now, I'm Dr. Lomferndi. I'm a pediatrician. I talk to parents daily about their food, their nutrition, their kids, and how you can help your kids really thrive. Now, over the last few years, I've really focused on eating and picky eating because we're seeing it increasing at an alarming rate. And my goal is to help you understand, connect with your child, and nourish them because that's what we parents want to do. So in today's video, I'm going to talk about, is your child's picky eating really anxiety? Now, a lot of times parents have tried it all. They've read the books, they've gone to the therapy sessions like the patient I talked about, they've tried rewards, and it's not working. And there's a lot of tension associated with meal times where at this point they're either just they've given up and they're giving them separate meals, or the kids are just snacking all day because that's all they'll eat. And we're just at a loss and we're giving them gummies for vitamins just to help, right? So the question is your child's picky eating actually anxiety? Now, some kids, though, there is a normal where usually between the age of 2 and 5 to 6, you have that normal phase where the kids are wanting to create their own choices. They all go through that picky eating phase and then they get better. But not every kid is the same. One kid maybe have a preference issues where usually with the normal kids that are going through that normal phase, it may just be preference. I want this, but I don't want that. But eventually they try new things. As time goes on, they grow out of it. But another kid may legit be afraid of trying new things. And typically when you have that kid that has that legit fear, there's some history of gagging. They may have gagged when they were eating a food. They may have vomited when we forced them to eat, right? Or it may have been where there was just a family stress related with meal times. Or it could have been they had a viral illness where they vomited after eating a particular food. And after that time frame, they started associating mealtime with a threat. And when the brain associates mealtime with a threat at every given time around that table, around mealtime, this particular kid is trying to do everything that they know how to do to protect themselves. Because once you feel like it's a threat, it's like run, hide, duck, and your nervous system gets activated, the heart rate goes up, the stomach tightens, and all they're thinking about is safety. I'm going for safety. So that's why rewards don't work out, right? So if you're trying to run away from a fire and someone is saying, oh, go into the fire and I'll give you a star. Well, it's not going to work because the brain is not thinking at that point. They're thinking, this is scary for me and I am trying to run away for safety. So it may look like a kid who's like, my tummy hurts. They're throwing the foods. They'll cry. They'll do whatever it takes for you to let them or release them from the table that if associated to as a threat and go into safety. And they'll stay focused on their safety foods. And sometimes when we start masking veggies into their safety foods, those safety foods do no longer become safe. So their list continues to shrink and shrink and shrink. So if you have a kid whose safety list is shrinking over time, if you have a kid who starts asking you about mealtime or what's for dinner hours before mealtime, or if you have a kid who's gagged before in the past around mealtimes, if you have a kid who is just legit scared and say, my tummy hurts every time it's about around mealtime, it may really not be the picky eating itself. It may be the kid has anxiety that is presenting as a picky eating. And if you start dealing with that anxiety as a normal way you would deal with a kid whose nervous system is calm and regulated, it will backfire all the time. So pay attention to your kid. How are they responding to meal times? Are they asking lots of questions? Are they always complaining about symptoms like my tummy hurts, my head hurts? Are they throwing the food? Are they doing whatever it takes to have you excuse them from the table. If that is your kid, it actually may be anxiety and not picky eating. And if you're nodding to any of those things I've talked about, or if that sounds like your kid, and then this video is for you, when picky eating is anxiety, how you can figure that out for your kid, which I'm hoping by the end of this video, you would know that by now. And the fear loop and some simple strategies you can start using at home to kind of help your kid through that anxiety phase and back into safety. Because remember, the kid is seeking safety, and it's really not about the food. And sometimes we push the food, we don't nourish them, but it's really not about the food. And if you have a little one who is scared and has anxiety, I also have a book, The Worry Garden, and it talks about how they can help, just a playful, story-based way, on how they can help. You can help them, whether it's through mealtime, whether it's through bedtime, to face the fears and face the anxieties that they're facing. Leave a comment in the comment box if you have any questions. And I guess it's Dr. Ferndi. Until next time, bye.